this medical role play, I will be giving you Botox and fillers. So I will come very up close and I will whisper in your ears. Please consider subscribing to my channel. Give this video a thumbs up and leave a comment down below. I have a Patreon where I upload exclusive content every week, and you get the chance to win a custom video every month. And I have a mental health based podcast where I also implement my ASMR content. It is called the Anxiety Blender, and you can listen to it every podcasting platform. Thank you so much, and now up to the video. Hello, welcome. Please come in, have a seat. You're here today to get some Botox and filler, correct? Wonderful. No, there is absolutely nothing to be ashamed of, absolutely no judgment. It's my job and my pleasure to make you feel wonderful in your own skin and enhance the beautiful features you already have. Before we get started with the treatment, I would love to have a little conversation with you. First of all, to learn what you would like, and second of all, to notice and study how your facial expressions work so that I can better create a look that suits your natural movements and beauty. Don't mind my nails, they are so botched. I'm just trying to get some press-on nails out, but the glue got burned and my pinky fingers look sick, and one pointer finger is gone, the other is still here. It's just crazy. Please don't look at my fingers, and I will be wearing gloves throughout the entire procedure, so you will not be distracted or offended by my nails. What would you like to obtain with this procedure? Okay, so you would love to have bigger, more plumped lips, and overall prevent the aging around the forehead and eye area, correct? Oh, okay, so if you wanted to have a fuller, more youthful looking smile, I would just inject a little bit, just a tiny little bit. I would just inject just a tiny little bit of fillers just in your cheekbone area, a little bit, you will not even notice, and that will give your smile a fuller effect. But overall, the idea of having an uplifted face comes from tiny little things we can do around the forehead area. And of course, today we will not undergo any invasive procedures. It's just gonna be tiny little pinches with a small, very small needle. You will not even notice it. Okay, do you have any questions specifically? Okay, so the pain is not depends on every person, of course, but I would say that on a scale from 1 to 10, where 1 is nothing and 10 is like the biggest pain you could possibly feel, exaggerating, on average it would be 2. Absolutely not a painful procedure. There is no recovery need. You will have a little bit of bruising, maybe eventually in the upcoming days, but nothing that wouldn't be covered with a little foundation or cosmetics, you know? And you will be able to go back to your normal life by tomorrow. I would say by tonight, but since we'll be applying numbing cream on your face to further prevent any discomfort, you know, the numbing cream tends to accumulate a little bit of water slash bloating, and you wouldn't feel 100% at ease if just going out tonight. So as prevention slash better recovery, I would recommend staying away from sources of heat, sweating, so I wouldn't recommend you going to the gym tomorrow. Just give yourself a couple days, but just for a better result overall. And of course, do not smoke, do not drink any alcohol. That's the best prevention ever in any case, but especially when injecting hyaluronic acid into your skin. Smoking alcohol would just counteract the action of it, minimizing the effect you would get and the benefits, of course. So, with this being said, if you allow me to, I would just put my gloves on and come real close to you, analyze your face a little bit while you specify me a little more about the goals you have in mind. So, tell me a little bit about the lips. Your lips have a wonderful, very beautiful shape. I would stay faithful to it. Yes, absolutely. I don't like to do comparison with celebrities, honestly. Can I come closer while we talk? Thank you. I wouldn't like to do comparisons with celebrities, as I said, just because, you know, they create fake expectations. We are individuals with our own unique features, and by comparing ourselves to celebrities or just be willing to look like somebody else, we would have an expectation, as I said, that would end up disappointing you at the end of the procedure, because here we are enhancing your features and your beauty. We are not changing you completely, okay? This is not an invasive procedure, and honestly, I would never recommend to sacrifice your individuality for an invasive procedure. That's just my professional and personal opinion. Everything looks better when it's more natural. So, the lips, you would like them to be a little more plumped, as you said, but how? The natural shape of your lips is very beautiful. I love your cupid's bow shape, and I would like to enhance it, as I said, and keep it like that. I wouldn't want to camouflage that. Sometimes people like to inject filler just in the cupid's bow, so the overall effect is that fuller looking lip. But in your case, I wouldn't do that, because in my opinion that wouldn't suit you. Wonderful. And the bottom lip is already wonderfully proportioned. So again, here I would go ahead with just a little more fullness, but I would keep that definition, maybe enhance it a little bit, but stay like that. Wonderful. So since we agreed to all this ideas and projects, I would recommend to go for, as I said before, something hyaluronic acid based, so something very natural, something that gets absorbed very quick and easily. Yes, it will last a little less than other substance based fillers, but those other substance based fillers might give you a fuller look, might last a little longer, but they also look a little more artificial. That is according to the patient's tastes and goals, but in my opinion, since we have the same view, I would stay on the hyaluronic acid. Absolutely, yes. Especially since you told me it's your first time, so let's keep it simple, let's keep it natural, let's keep it more reversible. Of course, none of this procedure is permanent, but again, something that lasts a little less but can be built up through time eventually is my best advice for you in this moment. Yeah. For the Botox portion, I wouldn't exaggerate because I don't want to freeze your entire face, especially because you don't have major lines. It's just prevention here. So I would just go a little bit on your forehead, but staying something like 2 centimeters away from your brows, so you will still be able to move them and have natural facial expressions, and that will trick everybody into thinking you haven't gotten something done if that's your concern. Wonderful. And we will further define, and when it's gonna be time to go for the Botox, I will use this pencil to trace the areas where I will inject the Botox. Going back to the filler, I will proceed with the cheek fillers after the Botox, so I will already have a little bit of an idea what and where to inject so we don't exceed. Okay? Wonderful. So since you're wearing a little bit of makeup, don't worry. I will just remove that for you. Relax. Tell me if I'm being too harsh on your skin. Alright. By the way, yes, these are reusable cotton rounds. Of course, I wash them and sanitize them all the time, but here we are very self-conscious about the environment, so I just prefer to use them rather than disposable ones, so I can remove your makeup. And no, don't worry, you're not making me work extra hard. I'm used to our patients wearing makeup and I don't mind removing it, especially because if wearing makeup makes you feel more comfortable, I want you to wear it until the very last second, so you're gonna be your true self here, you know. Yes. My priority is to make you feel comfortable all the time. Look, this was all the makeup you had left on your face. Now that it is removed, I'm going to quickly sanitize it. Sanitize your face with a gentle alcohol-based solution. It is not aggressive on the skin, even if you might think that alcohol is aggressive on the skin. This is a special solution that has been designed to respect your pH balance. Yes, so you don't have to worry about anything. No, Wonderful. Now that your skin is all cleansed and sanitized, I would just go with the application of the numbing cream. So the numbing cream will prevent any pain or discomfort to appear, manifest during the procedure. Alright, I'm just gonna apply it. And while the numbing cream works and does its magic, I'm just going to trace the places where I will be injecting the Botox. Later on. Alright, wonderful. So now your entire face is coated with a numbing cream. And it's time to start tracing the place where I will be applying the Botox. So now I need you to follow my instructions, okay? So I want you to frown like you're very, very angry. Okay, relax and frown again for me. Very good. Now we're tracing the eye area. Alright, relax and frown again, because we are moving to the other eye, and we will be tracing here. Okay, I now need you to raise your brows super high like you're very worried. Good job. Yes, raise, keep them raised like this. Very good. You can now relax. And again, raise your brows. Very good. So, tracing the brow. Relax. And one last time, raise your brows super high while I trace my lines here. Alright, wonderful. So as I said, we didn't need much work because relax for me, please. Yes, we didn't need much work because you don't have major lines, so we're just going to prevent the aging process by injecting just a little bit of Botox. You don't need much. Wonderful. Okay, perfect. Now that we're all nice and traced and the numbing cream is starting to work its magic, I want you to fully relax. So I will explain you what is going to happen. This is the product we will be injecting in your skin. One is the Botox and one is the filler. They are inside this sterile, disposable wrap. So they are sanitized, clean, and the expiring date is next year. So there is nothing to worry about. I will start with the filler. But before we get started, I'm going to put on my surgical mask because now I will be very close to your lips and I don't want to create any discomfort. So, as you can see, the needle is very, very small. You're not even gonna feel it. It's like a mosquito bite. Okay? So we now get started. Are you ready? I want you to breathe very, very deeply in and out of your nose. And if by any means you're feeling any pain or discomfort, you just let me know. Okay? So now I am defining your entire lip shape. So I'm going to do some very, very, very small injections along all the border of your lips, just to give it a nice definition and enhance the wonderful shape you already have. And I'm also going across the Cupid's bow to really make it pop and enhance its shape again. Okay, I'm now going to gently massage your lips like this to distribute the product. Alright. And now I'm going to make different injections inside the lip to give it a nice volume and create harmony in your lips. So, tiny pinch, tiny pinch, tiny pinch. And when we flip the lip like this and go from underneath, that's when we really create the volume you like. We're gonna do the same in the lower lip. Tiny, tiny, tiny pinches. Pinches. And then we flip a little bit and we go from the bottom to the bottom, if it makes sense. Just like this. We massage. And I to give a little bit of love to the corners of the mouth. Again, here to create harmony, but absolutely avoiding the dark effect. Alright, so in my opinion, we're done with the lips. I don't want to exaggerate too much, so it looks plumped but natural. Do you want to have a look at yourself? Just look at yourself and tell me what you think. Okay. Yes, as you say, I think the natural result is better, and it's looking good. I love the way it looks. Are you happy? Wonderful. I would now proceed with the Botox. I'm going to use the other syringe. I will just remove the mask because I don't need it anymore. I'm not going to be super close to your lips anymore. So now I will move on. Again, I ask you to please frown for me. And we're going to do some small pinches right in the areas that I lined before. Okay, relax. Let me just. Okay. Can you please frown again? Wonderful. We're going to move to the side of the eyes here. The hands, feet. They called like that. In my native language, they call them like that. So we are getting rid of them right now. Wonderful. Relax. Let me just quickly. Okay. And we move on to the other side. So please, you frown again. Let's go ahead. Put the clock backwards with this tiny, tiny, tiny little pinches. Alright, relax. So was that painful so far? I knew you were gonna handle it. So now I ask you to raise your brows again, please. Very good job. Raise the brows and keep them like that. Okay, wonderful. Now just relax for me, please. Relax for me, please. I ask you to raise them one more time. Let's just inject a couple very small pinches of Botox here. Very, very, very good. And I'm gonna ask you to raise your brows one last time for me. Wonderful, wonderful, wonderful. Good job. Good job, good job, good job. Of course, the full effects of the Botox will only be noticeable in about 1 week, a couple days to 1 week. So now you will see some bumps where I injected the product. You don't don't have to be afraid. That's totally normal. You might end up bruising a little bit or feeling like you don't have full control of your face. That is, as I said, absolutely normal. Don't be afraid of that. So now that I can already see what is going on and the new proportions in your face, I would move on to the cheek fillers. We're taking the filler to give more plumpness to your cheekbones and give you a more youthful smile. Okay, so you just relax. Thank you. I said and I promised you that it was gonna be a very, very, very natural effect, and that's what I'm doing. I don't want to make you look like plastic. I want you to still recognize yourself, learn how to embrace your features, and just appreciate them. Just notice that with a couple of procedures like the ones we're doing today, you can get this effect that might look very cute, but as I said, it's not permanent. So anytime you want to go back to your natural beauty, there is absolutely no side effects. It's not high maintenance, so if you get tired of the filler, your skin will not behave in a weird way, like when you remove an implant, That's just absolutely very, very natural overall, so nothing to be afraid of. Okay. Alright, okay. I want to ask you to give me a wonderful smile, please. That's so wonderful. I will give you the mirror once again. Please look at yourself in the mirror and tell me if you like what you see. Yes, the effect is absolutely natural. It's really like yourself, but more enhanced. I don't even want to say yourself, but better, because I always say that we all look beautiful the way we are, but it's my job to bring out the things you want to improve or to enhance again. So absolutely, that's what we went for. Okay, so now I will be applying some healing lotion onto your skin. This has a sanitizing as well as healing properties, so it's 2-in-1, and I will give you some to take home because you will have to apply it on yourself. For the upcoming week, the upcoming 7 days at least, twice a day, morning and evening. And if you have any spare time and you want to give your face a nice massage, just no pressure, a very relaxing massage like I'm doing now. You just go on the cheekbones with a very light hand then just massage. Slightly, slightly, slightly pinch your lips and massage. Slightly, slightly on your forehead. That will help the products more evenly distribute and overall work faster, blend with your natural skin, and that's gonna be wonderful. Alright, so the procedure worked wonderfully on you. I am sure you're gonna fall in love with the results. You will see in the upcoming days. Of course, my professional eye can already tell. And sorry, I'm trying to remove my gloves while talking to you. As I said, you will fall in love with the results. Okay, don't be afraid if you see a little bruising, if you see a little redness eventually. Of course, if things look abnormal, you don't hesitate but call me, but that should not happen. You go ahead and apply the product I applied on you before. My assistant already knows and has it prepared for you. And one last thing, my assistant will also give you an ice pack or two to apply on the areas so that we minimize the bloating and bruising, and we also keep the area a little numb for longer in case you might have a little bit of discomfort. Alright, we will meet in 7 days for a checkup, see how things are proceeding on your face, and if you want to adjust the things, if there is something you want to talk about, we will talk about it that day. Alright, my assistant will give you the appointment. Thank you so much for coming here today and choosing me to take care of your wonderful face, and I cannot wait to see you again. Please, if you like this video, don't forget to give it a thumbs up and comment down below. It really helps me. It is vital, so please do so. And also subscribe to my channel so I can keep providing you with more tingles. Thank you so much again, and I will see you next time. Bye.